Good morning. My name is Stephanie, and we're at Brain Training for Parkinson's with PD Active. This month, we're starting a new series, and we're going to be focusing on indirectly and directly focusing on breath expansion. And what breath expansion offers us is a few things, and why I think breath is so emphasized for anyone with movement challenges. Breath is the first thing that you take in life and the last thing that you take in life. And so it is a signal of your liveliness, a symbol of your liveliness. Your brain requires a good supply of oxygen to think clearly and be reactive in your body. With breath, we're doing breath, we're breathing 24 hours a day, 7 days a week. So if we can make our breath just a little bit more efficient, let's say 1% more efficient, we are going to be more efficient 24 hours a day, 7 days a week. Okay, so it's a little thing that makes a big impact over the course of time because it's something we do all the time. Okay, I could go on and on and on about that. What I do love exploring about breath, especially as it pertains to movement, when we increase our breath control and we are more aware of our breath, I call it down regulating the nervous system. So taking us from a flight or fight response where there's a lot of rigidity and tone and brings us down into a parasympathetic state in our nervous system, which allows us to have this body awareness, have more control, have more balance, have more perception of our surroundings, and have those cues of safety that allow our body to relax and let that rigidity go. So if you're one of those individuals who experiences kind of full body rigidity that seems relentless, breath is a really easy, accessible point for you to then downregulate your nervous system and get ease some of that tone. On the other side of that, from a movement perspective, breath expansion is a mechanical phenomenon. So when you expand in your ribs here to take that full breath, you are stretching your spine because your ribs, they come around and they attach into your spine here. And every expansive breath you take, the ribs sort of create this wedge and decompress your spine. So the ribs flare out to the side and they wedge kind of the vertebrae apart from one another. It's like a lever. So with every expansive breath you have, the more mobile your spine comes, the more rotation that you have in your body, the better your gait is, the more massage your organs get. It's sort of this trickling effect. So breath has so many different avenues that it can help you with. And so I think it's an important thing to consider when we're working for body movement efficiency and then also the nervous system state in our body. They sort of like all feed into each other. So in terms of how does breath pertain to brain training, again, the brain requires good oxygen supply. It also supports that downregulation of your nervous system. Okay, so I will either be indirectly or directly influencing breath through the classes in April. Today, you are going to be needing your letter ball. You can use your letter ball for the entire class, but there is going to be a portion that some individuals don't like using the letter ball and they prefer using a yoga bolster or a stack of throw pillows. So I recommend just grabbing a stack of throw pillows for today and seeing if that works well for your body. And if you decide that you like the letter ball, then next time you don't have to get your throw pillows. Okay, so let's do a little check-in with our body first before we go into all the interventions. You can sit, stand, wherever you want to do your pre-class body awareness scan, body awareness assessment. We'll do a static assessment first. Go ahead and breathe normally in and out through your nose. And just bringing attention to the quality of your breath here. Does it feel restricted? Does it feel expansive? through the passages that your air flows, do they feel restricted or do they feel open? For example, I'm having a lot of allergy congestion today, so I feel really restricted in my nasal pathway. So for yourself, just take some notes on how that feels. Note for yourself which pathway you take your inhale. Do you take it in through your nose or your mouth? And which pathway do you prefer to exhale? Noticing where that air travels. So as you inhale through one of those pathways, you feel it inflow through your throat. Does it fill your chest? Does it fill your ribs? Does it fill your belly? Where does that air flow throughout your body? And then noticing the timing of your breath. How quick is your inhale in comparison to your exhale? And also noticing the breath hold and the vacation stage of that breath cycle. So you inhale, there's a moment where nothing happens, that's that breath hold. There's an exhale, and then there's a moment where you don't have any air or you have very little air in your lungs before you take that next inhale. How long can you, not how long can you, because you're not trying, but how long does that breath hold sustain, and how long does that vacation phase last without trying? What's natural to you right now? So that's sort of the quality of your breath. Now let's look at the changes that happen when you inhale and exhale in your body, and then also the body position. So go ahead and just tilt your head towards, so you have your ear towards your shoulder. And if you need a little visual, you can look at the screen. And we're just going to move our neck right and left, ear to shoulder, and take into account this neck mobility here. How does this feel for you? And then center yourself up. That was a little vestibular exercise, wasn't it? We're going to rotate and look over your shoulder. Notice that neck mobility. Rotate, look over your other shoulder. Notice that neck mobility. And notice for yourself too, when you rotate, because this is important, when you rotate, do you rotate your shoulders too, or can you just move your neck? Shrug your shoulders up to your ears and then let them drop, shrug them up, let them drop, shrug them up, let them drop, shrug them up, let them drop. Last one. Good. I'm going to turn to the side for this, and now I want you to stick your head out in front of you and then pull the base of your sternum, sorry, the base of your neck up and back behind you, so it gives you a double chin. So we're going to go forward through the neck and then pulling back, pulling through the neck. So we established that the breath travels through your neck. So the positioning of your head as it sits on top of your rib cage, it can influence your breath efficiency. And you can even hear the change in my voice as I move my head back and forth. And then give yourself a little wobble and notice now where your head stacks over your rib cage. Do you feel like it's in front of you? Do you feel like it's really far back? Somewhere in the middle? Let's go ahead and place your hands on your rib cage. Sort of where you would maybe put like a heart rate monitor, a chest strap heart rate monitor for ladies, maybe where the base of the bra strap is. If that's hard to feel, that's okay. Maybe just find something where you can touch your ribs, either in the front or the back. I prefer the side here. Go ahead and take an inhale and try to push out on your ribs. We did this a little bit last week. And then exhale, let the ribs draw in. So this is what I was talking about before with the wedging. How well do your ribs expand out with that inhale? And how well can they collapse in and compress in? And you can facilitate that a little bit externally by using your hands. So kind of pulling, not pulling, but imagining pulling the ribs out and then giving yourself a little compression in the side of the ribs. Mm-hmm. Inhale and exhale. One more time, inhale and exhale. So again, noticing the quality there. Good. Let's have you stand up if you haven't already. And I want you to pick something in your movement repertoire that you care about improving. So if that's gait, if that's a single leg balance, if that's ease getting up and down from the floor, find a movement that you care about improving or something you care about improving, and go ahead and do that movement a few times, taking some notes for yourself about how you do that movement. How efficient are you in that movement? Okay, so walking around the room, maybe your foot mobility, how easily are you able to get up and down from the floor? There you go. I like that. Walking backwards was a good one. Do you shuffle when you walk backwards? Maybe some squats, maybe a turn. How well can you turn around? And again, take some notes. How many steps does it take to turn around? Do you freeze? Okay. I want us to have something that you care about so that if it does change, then you go, wow, I'm digging this. Excellent. So we took an assessment of our quality of breath. We took an assessment of how our body positioning changes or influence breath. And then we also did a functional movement that we care about. All right. We are going to start at the top with some self-massage techniques, and then the movements will get more active as we go along class. So if it feels like it's starting slow, stay with me, we'll get more active. You can do this seated or standing. You just need your fingertips for this one. So as I talked about, the air flows in through the nasal and the mouth cavity, through the throat, and then expands through the chest and abdominal cavity. So we are going to do a little bit of self-massage to open up the nasal cavities, open up your mouth, open up your neck, and all of that. Okay. We're going to start at the top here and just sweep underneath your eyes, pulling your skin out towards your temples. You do not have to press hard. We're just stimulating the skin. And right underneath your skin are those nerves that control the tubes in your face, the cranial nerves that control how tight is your nasal pathway and how open is your nasal pathway. So you're indirectly influencing your nasal passage here. Okay. Last one. Beautiful. All right, we're going to go down to the corner of your mouth, corner of your jaw. If you put your thumb there and you move your mouth, you should be able to feel the jaw move. Yeah, that's how you know you're in a good spot. We're going to take the corner, kind of like the corner of your thumb here, slide it towards the chin. Give yourself a little bit of an underbite when you do it. And then if you want to slide back and smile on the way back. And then underbite on the way out. Smile on the way back. And if it feels a little gnarly, that's kind of normal. Especially on one side, I usually get like a little bit tighter on one side. My puppy's looking at me. I trapped her in the corner with all the equipment behind. She's like, I want to come over and hang out. Okay, last one here. Good. And then we're going to pull on those ears a little bit. We did this last week. Pull them out to the side. Maybe take a little inhale through your nose, a big inhale. I'm already feeling a little bit of a difference there in my congestion I mentioned before, at least for myself. I feel a little congested today from the allergies. It's feeling better. Good. We've done this one before too. We're going to now go into your throat and your neck. We're going to do your skin lift technique, skin lift. So you're going to pinch the skin, pinch it with the other finger, and then roll upwards towards that corner of your jaw. Yep, pull the skin up. Gets a little gnarly at the top there. Scoot over an inch or so, and then roll back down. Then once you get to the collarbone, scoot over an inch, roll back up. So you should be able to get sort of 3 passes before you get to your trachea. If you have a really thick neck, maybe you can get 4. Good. And then we're just going to crawl over the top of the trachea. Trachea is your throat. And then roll down that side. Oh, I didn't mention too for breath at the beginning benefits. Those of you who have impacted speech, volume projection, the better your inhale is and your exhale is there, the louder your speech gets. So that's another quality. If you want to check that before and after these sessions, you can say something to your partner or voice record on your phone, and then afterwards check that. That would be kind of interesting. Okay, so good. This one's kind of weird. Stay with me. It's always weird, isn't it? You're gonna grab gentle pressure on your trachea. So actually, if you feel your trachea, you're gonna feel up here sort of this like big knobby thing. That's your thyroid. We're gonna go right below that. We're not gonna mess with the thyroid. And we're just gonna do a little side to side traction here on the trachea. And if you were to put your fingers here and hum, you should feel a little vibration underneath your fingers. That's how you know you're in a good spot in the trachea. Trachea is also known as your windpipe, right? Where your vocal cords sit. That's what I meant with all of the voice. Good. All right. Go ahead and turn your head. Bring your head right and left. We did this at the beginning. See if that improved. Turn your head right and left. See if that improved. Take a big breath. See if that improved. We're going to do one last thing for your neck. I like this one for neck rotation. Bring your hands to the very underneath the earlobe. We're going to pull the fingertips across and look towards this elbow here. As you pull across, turn your head. Pull the fingers all the way over towards the earlobe on the other side. And then we'll reset. And right here, I'm just using sort of like a rock climber grip on the back of my neck to pull the tissues across. And you're going to do 4 passes. 1. Oh, this one has a big impact for me. You can already, I'm going to inhale through my nose. 2. 3. And 4. Good, nice job. Let's do 4 on the other side. If this is challenging for you to do on your own, maybe not now, but later, you can lie. This is a little too big. You can lie on a pillow, on a ball that's half deflated, and roll your head back and forth on the ball. Okay. Go ahead and work through this one. Or, yeah, let's do 4 on that side. Let me show you another version that you could do if you were trying to do this on the floor. You can roll up 2 balls of socks, or you can get some of these foot release balls. They come in a sack. You just put them right at the base of your neck and do any sort of rotation like that laying on the floor. Okay. Okay. If that felt good and you did your 4, check your range of motion again. Look to the right, look to the left. Oh boy, that was a lot more. Now I freed up the left side of my neck. Awesome. Okay, we're gonna move on. A little bit of shoulder, rib. So we're gonna massage the collarbone here. And we're gonna create some traction on the skin. Go ahead and make your hands really wide here. And so one hand on your collarbone and one hand up. You're gonna pull the skin sort of in and down as you bring your arm up overhead, like you have a burning question. Straighten up that elbow and then reset back to the tip of your shoulder. So we pull the skin in, down towards the sternum, and then up and overhead with the arm. Traction, pull, lift. And I mentioned this before, skin on skin is best. That's why I'm going underneath all my straps here. Skin on skin is best. Obviously, if you're wearing a shirt that doesn't allow that, try to pull the skin through the clothing. Beautiful, nice job. Take that arm, swing it around. Add a little rotation with it. Rotate your body. Good, let's do the same thing other side. Tip of the shoulder, jazz hands, number 5. Here we go. Traction, pull, float the arm up, and then return. There we go. Burning question, reach that arm up nice and high. There you go, David, nice. Left. Elbows straight, touch the ceiling. There you go, last one. Excellent, nice job. All right, we're gonna come onto the floor next. So if you haven't already made it down there, go ahead and come down to the floor. This is where we're gonna use our pillows or the ball. I will show with the ball, the pillows will do the exact same thing that the ball is doing. I'll give you time to get down. All right, so you're gonna end up laying on your side here. Oh, I think I've done this so many times that I just put my body in this position and I don't even have to do the exercise. My body just goes, oh yeah, okay, I'll relax. Okay, the ball is gonna go underneath your rib cage. So you may think the ball feels most comfortable sort of like in this like crux of your waistline, but I want it to be higher. I want it to be on the rib cage. Now, this is where I said sometimes the ball feels too hard. So using a stack of pillows under there works as well. Okay. Again, I'm going to just show a few options. You can kind of find what feels good for your body. Because remember, we want your body to feel restful and easeful. We don't want this to be uncomfortable. So always use props, always support your body in a way that makes you relaxed and feel like you can release that rigidity and tone. Okay. We're going to let yourself either drape over the ball here, or you can give yourself a little prop in the head, your choice. Reach that top arm up overhead, big fingers to expose the top ribs. Right here, I want you to inhale and drape further over the ball, exposing these ribs like an accordion, just like open up, good. And then push down and push your bottom ribs into the ball or into your pillow. So you're going to shorten on this side and then expand here. So we're going to go up, expand over the top. Very good. And then down and lift. So there's a little side crunch. You can use this bottom hand as much as you need. Inhale into those ribs. Stretch this arm up so that you clear the shoulders so the ribs can expand. And then coming through. Very good. Inhale over. Ah, yes, nice job. Let's go 3 more. Inhale. Yep. And last one. We're going to drape over the ball and stay there. Find a comfortable position. I'm just going to give myself a little bit of support. We're going to reverse the breath pattern. So I said, as you drape, we expanded the top, but this is where it gets a little tricky. You're going to try to breathe into the ball this time. So inhale, try to push the ball down, and then exhale, try to lift the ribs up and lift off the ball and get more side bendy. Sometimes it helps to sort of inhale and come up, and then exhale, drape over. So it's the exact opposite of what we did before. Inhale, come up, push into the ball, and exhale, come down. Inhale, float, and exhale, come down. Good. Last one. And down. Nice work. From here, place the ball off to the side or take the pillows out, and then lay yourself all the way down on your side. I want to say we did this one last week too. This is the weird one where we push our stomach tissue. So skin on skin is best. Roll up your shirt. Use your fingertips to find the base of your, what is that? Your ribs. Yep. Find the base of your ribs. Come on, anatomy. We're going to push our fingers sort of in and down, somewhere between your belly button and the base of your sternum. So if you want to feel that in your body, and then push directly down towards the floor. Good. Now, for some of us, as you go through kind of the center, you're like, okay, all that tissue got bunched up and it feels a little hard to get through. Instead of just pushing down, kind of like work your way over the top of that and then continue down on the other side, right? There's like this like point where it all sort of gets bunched up, kind of come over the top of that and then continue down. Okay. Now, if you're coordinated, we're going to add a rotation with that all at the same time. So you're going to push the tissue and roll backwards with your upper back only. Try not to move your hips. If you're lucky, you may get a little crack, a little adjustment. And then pull back to your start position. Just a little rotation in the trunk, taking your eyes back. Yeah. Good. One more time. Beautiful. Nice job. Go ahead and roll down on your stomach. And you can have your elbows kind of wide with your fingertips or your index finger touching. And just start to wiggle your hips on the floor. You can kind of push off your knees a little bit. If you'd like to bend your knees up and create a little bit more of a windshield wiper. So your feet are looking towards the ceiling. And then go ahead and let your left leg go long. And we're going to roll the right thigh and pull it up. So we're in this kind of, we call it reptile. You have one leg straight and one leg out. You may be rocked a little bit more on your left hip, but you may feel a stretch on your inner thigh there. Push through your arms to help you get a little bit of a lift so that you can slide that leg back. And we'll do the same thing on the other side. We're going to kind of rock onto the right hip, pull the left leg into reptile. Okay. Let's go through that a few times at your own pace. Press back, shift over, and pull. Shift back, press over, and pull. Let's bring the eyes into it. So we're going to go in, look over your right shoulder when the right leg comes in. Look over the left shoulder when the left leg comes in. Which side is it easier to look? How far can you see behind you on one side versus the other? You're bound to have a better side. Just notice. Yeah, one more time here. Good. How does that correlate with the side that we worked on last time, huh? All right, press back into quadruped. Sit back into just a quick child's pose or some sort of restorative posture with the hips flexed. And then we're going to set us up with the ball on the other side. Set us up with the ball or the pillows on the other side. So remember, you want the ball to be kind of at the high point of the rib. So again, where that chest, like heart rate monitor might sit, like right above that. Good. And then either support your head or let yourself drape. Either way, we're going to bring that top arm up overhead so that we create space for the rib expansion on the top side. Open up like an accordion, big stretch and reach. Good. And then we're going to press into the ball and lift up just a little bit, pushing your bottom ribs down. Now, here's the deal too. Make sure that you're not rotating in your body, that you're not rotating here when you come up. You're just lifting into your side bend this way. Inhale and exhale. Good. Inhale into the top ribs and exhale. So you're just thinking about the top side. We'll think about the bottom side in a second. Good. One more time. Let's go drape and hold. Now with this one, remember, we exhaled to lift off the ball. Inhale, push into the ball a little bit. Again, use your hands to support your head, whatever feels right. Exhale to lift off the ball. This one's hard for me. Inhale into the ball. Exhale, come off of the ball. Inhale. Send your air into the ribs that are pushing the ball down. Good. Nice. Inhale and inhale. Oh my goodness. Talk about brain training. Last one. Nicely done. And I'm hearing my intestines move around, which is a good sign. We're going to take that ball out when you feel ready. And all of a sudden you feel super expansive on that rib. And lie on your side. We're going to do the traction here. So find the base of your rib and note where your belly button and the base of your sternum is. Push all that tissue down towards the floor. Again, go over the top of the collection and all the way through to the other side. Yeah, my tummy's talking to me. Is it lunch? No, I just had a snack. I'm not hungry. This is just what happens when you start mobilizing the viscera, the organs. They start growling and they're happy. And the kind of rest and digest key phrase for parasympathetic state. It's a good sign. This one has a big impact on me. You can tell when I start losing my words or my voice trails off. It's a good sign. because I get so relaxed, I just stop thinking. Good. Add the little rotation if you feel coordinated to grab that as well. So pushing the tissues down and rotating back. Turn your eyes. Oh, and if you feel this in like very specific spots in your back, that's what I'm working for here. I'm looking for motility, called motility, but we can call it mobility of your organs, which allows your skeleton to move a little bit more freely. It's an interesting concept that I've been seeing more and more. Last one here. Excellent job. All righty. I'm going to have you roll over onto your stomach again. Okay, I did say either pillows or ball, but hopefully you have both. Okay, what we're going to do is we're going to place the bolster either, I like it better, your pillow's underneath your hips, we'll say, and then the ball is going to go right underneath your sternum. Because if I didn't have the pillows under my hips, this would be like kind of a lot of extension in my back. So I just want the pillows underneath my hips in some way, kind of level the playing field. And then the kind of where we said the heart rate monitor would be, like kind of at the base of your sternum, we're going to place that ball and then I'm going to do it. I can't talk at the same time. Let yourself drape over the ball. And what I'm looking to expose is the space in between your shoulder blades. And I want you to feel the breath expansion in that place. If this feels claustrophobic for you, go ahead and just lie on your stomach and breathe. Or actually, you can come up onto your elbows too if you're feeling claustrophobic. Helps a little bit. But you'll have a greater effect if you can allow your spine to drape over the curvature of the ball. If you notice that your ball is bigger, it feels too big, you can pad up your hips a bit more with some pillows. Then I want you to take 3 breaths where you're trying to push your sternum on the inhale, push your sternum into the ball on the inhale. And then exhale and try to draw your sternum off of the ball. Kind of create the hollowing. So 3 of those. Sternum into the ball and then exhale. Yeah. And then after you've done the 3 that way, we'll do 3 breaths in the opposite direction. So you're going to inhale into the back of your body, lifting off of the ball on the inhale. And then exhale, push into the ball. Good. One more time. Excellent. Nice job. Once you feel good with that, we'll press off the ball, come into a child's pose or some sort of restorative posture where your hips sit back in your heels, or if this is not necessarily good for you or doesn't feel restful, you can lay on your side in a fetal position. Okay, this is kind of the last mobilization before we get into a little bit more activity. We're going to take your letter ball. If you do not have a letter ball, or another option would be a foam roller, we're going to place the letter ball right underneath our hips in this position here. If it doesn't feel right to sit back all the way up, just have your hands forward, or you can have your hands on a chair. Okay. What I'm looking to get here is a massage of the pelvic floor. So the tissues that are right underneath at the base of your pelvis that need to be pliable in order for an efficient breath flow. Okay, think of your breath as like a piston. Your diaphragm drops and lifts here. The pelvic floor needs to be able to ebb and flow with that diaphragm. Okay, so finding just by sitting here is good. Some of you may find this a little bit like interesting or not quite sure what we're feeling here yet. Just stay with me. I know it's weird. This class, we get weird, right? If it feels okay, you're going to just rock back and forth, side to side, or you can go tucking under and expanding out, tucking under and expanding out. Okay. Good. And again, if that doesn't feel good, the pressure doesn't feel good, just lean forward a little bit. Excellent. All right. Go ahead and come off the ball. You can put the ball off to the side. And then go ahead and lay on your back. Feet flat. Palms facing up. We'll do a couple articulating bridges with the arms reaching up overhead. So we start with the arms down by your side, press the hips up, standing on your shoulders. Snow angel the arms up overhead past your ears. Reach the fingertips to the other side of the room as your spine slinks down towards the floor, and release your tail, widen your sit bones, and let go of that pelvic floor. Slide the arms back down by your side. Draw the tail underneath you. Peel your hips up. Push through your feet. Slide the arms up overhead. We have a lot of shoulder mobility hopefully now. Roll the spine down, keeping the arms stretched long and or heavy on the floor. Release the tail. We'll just do 2 more of those. Press. Snow angel. Roll. Find a breath pattern that makes sense for you. Last one. Lift, slide, and roll. Nicely done. Bend your knees in towards your chest and grab either behind your thigh, your calf, your ankle, maybe your pinky toe, and slide your other leg out long. So you have 1 foot looking towards the ceiling and 1 foot long on the ground. Again, you can grab behind your calf, behind your thigh, your calf, your ankle, something of that sort, but try to make your foot look towards the ceiling. So dorsiflex that foot. Good. We're going to slide that leg back out. Reach your arms up overhead, legs long, and grab your other leg. Sole of the foot towards the ceiling. Other leg is long and stretched out on the floor. Good. Now, can you do a little bit of both? Happy baby, grabbing behind the thighs, your calves, your ankles, or your pinky toes, and then rock side to side. There you go. Whee. Nice. All righty, from here, we're gonna roll over to the side, push up slowly. When I do this work, sometimes we're more susceptible to those blood pressure changes. Make sure you're not too dizzy. Go ahead and start making your way up to a stand position. Take your time, because as I said, with all of this work, we've opened vessels, we've opened things up. So you may get a little bit of orthostatic hypotension going on, so just be mindful. Clear your space. If you have a wall available, I would like you to use the wall. If you do not have a wall available, that's okay too. The wall is just nice feedback. We're going to do a standing exercise. The standing is optional. You can also do this in a chair. Okay, you will need your letter ball. We're going to do a little bit of your brain training next. Okay, so if you have a wall, again, the wall is nice feedback. It allows you to know whether or not you're doing your exercise in the full range of motion. So if you have your feet in an athletic stance, you have your ball or your pillow that you're holding on to. If I say left, you're going to rotate and touch the ball to your left. If I say right, rotate and touch the ball to your right. If I say up, touch the ball to the wall behind you. And if I say down, you're going to touch the ball down. Okay. Make sure that you're not so close to the wall that your butt knocks you off. Okay. Or maybe you can figure out a way to make it happen if you're close. Okay. So again, the wall is nice feedback for you to make sure that you get that full rotation in your body, that you're not just kind of moving the ball around in space. Okay. It's going to be the brain speed. So I'm going to give you those cues, kind of Simon Says, and you'll do the actions. I'll watch. Are we ready? Oh, we got a boxing glove. I love it. Here we go. Up. Right. Right. Down. Left. Right. Left. Right. Down. Left. Up. Right. Right. Up. Right. Left. Down. Left. Left. Right. Up. Down. Left. Right. Nice job. Walk around the room or do a few marches in place, crossbody touch on the knee, or you can do a few sit to stand, something that's sort of mindless and repetitive that you can sort of rinse. Okay, as you probably know, we're going to go a little faster next time. Okay, so the idea here is that we did all those drills to help you expand your spine. So you should have a lot of mobility available to you. And now we're going to put that in a sort of reactive, functional exercise of rotation. Okay, turning around. Now, if you're feeling agile and ready for level 2, we're going to turn it into a rotation. So you'd come off the wall a little bit. You'd step back to touch the wall. Okay. Up would still be up, down is still down. So just come off the wall a little bit so you have room to step. You know, did you see that? So you're rotating, stepping back. Okay. All right, we ready? Here we go. 3, 2, 1. Left. Right. Up. Up. Left. Right. Right. Down. Right. Left. Down. Left. Left. Up. Right. Down. Left. Right. Left. Right. Up. Left. Left. Down. Nice job. Walk around the room, check your range of motion, check your breath. Okay, we're gonna do one more set and then we'll check in. We'll do the post-class check-in with our breath and posture. No changes this time. I'm just gonna go a little faster. However, I am seeing, if you have a wall available to you, Alana, Adam, no? Okay. I want you to really get that rotation. Okay. Not just the ball. It's not just the ball rotating. Try to get the whole body to rotate. Okay. That's what the wall is helpful for. That's all. So just, you got to be a little bit more mindful in that. Okay. Here we go. Up, right, right, down. That's it, David. Left, right, left, right. Alana, much better. Down, left, up, right. Nice. Right, down, right, left, up, left, left, right, down, up, left, right. Nice job. Walk around the room, find your repetitive motion, flush the nervous system. All right, we're going to come back for that post-class body scan. You can put your ball off to the side. I want you to stand or sit in the way that you did at the beginning of class. Thinking back 50 or so minutes ago. Breathe in normally, and I know we just got your heart rate up a little bit, but let's see if we can calm that down. Take notice of your breath. Which passageway are you using for the inhale? And which passageway do you prefer for the exhale? Feeling the breath go through that passageway and through the throat and expanding into your thorax. Noticing the quality of those passageways. Are they feeling constricted? Do they feel open? How's the volume? Can we get more expansive in those ribs? If you want to place your hands on your rib cage to feel that expansive breath, let's go ahead and feel. Billy Bob a little higher with the hands. Yeah, there you go. Play around with your neck position. See how that influences the quality and the the quality and the efficiency of the inflow and the outflow. With your head jutting forward versus your head back versus your head somewhere in between there. Lining up your tubes, lining up your pipes in a vertical way that allows air to flow in and out easily. Go ahead, shrug your shoulders up towards your ears, roll them open, down and back. Feeling the shoulder mobility that might come with a bit more thoracic mobility. Bringing those arms up overhead, noticing the mobility here as well. I know we didn't do this at the beginning. And then release. Go ahead and check in with that movement that you did at the beginning of class, the movement that I said, check in with something that you care about improving, whether that's your gait, maybe your efficiency getting up and down from the floor. Maybe that was your single leg balance. I think, Adam, you did backwards walking. Checking in with that performance movement, that functional movement. Noticing, did it get better? Did it get worse? Both in efficiency and feel, rigidity. And then coming back to your place again, and let's just close your eyes for 30 to 60 seconds of quiet reflection on that last hour. Making notes on drills, mobility drills, massage drills that your body particularly enjoyed. And how you might fit those into your routine. If there's still room left in your routine, or swapping something else out, maybe that does a similar thing, but this works better for you. And earmarking two tangible outcomes from today's class that felt a little bit of improvement or a lot bit of improvement, whether that's just in the way you feel and perceive your body, whether that's a performance metric, you did something better. a flexibility metric, maybe even just an understanding metric of how your body works. Last deep breath in through the nose, arms come up just to inflate those ribs a little bit more. Round and hollow the front part of your body so that the back can expand, and then release and return. Nice work, everyone. Great job. Thanks for trying something new, the first class of April. I'm going to turn off the recording. If you have anything that you'd like to share with the group, you can unmute yourself and let us know.